Welcome, Houston, to Chai Time on 103.5 FM. We're so excited to be here this Monday morning, but with the warm weather. We're in almost October end and we're still like 90 degrees, so. But October is Breast Cancer Awareness Month. It's a global campaign that aims to raise awareness and promote early detection and prevention. With that said, we have Dr. Puri on the show. She is a board-certified oncologist and breast cancer specialist at Houston Methodist. Can you tell us more about yourself, Dr. Puri?
Hi, yeah. Thank you so much for having me over. So I've been in this field for a long time, but it feels almost yesterday. I did my medical school in India, and then in medical college in Ludhiana, and then I came here for my training. I did my residency in Arizona at University of Arizona, and they did my cancer training and my breast oncology specialization at Houston Methodist. So Houston is home, and I just decided to stay back.
Oh, that's great.
Yeah.
We're so happy that you're on the show. So what are the recommended screenings for breast health, and what age should we start them?
Yeah, so we generally recommend women to start at age 40 with an annual screening mammogram. Sometimes the patients who do have increased family history of breast cancer or have a genetic mutation that predisposes them to breast cancer will start at as early as 25 years of age.
Oh, really? Wow.
Yeah, but if you don't have any family history or otherwise healthy, then we generally recommend it starting at 40.
Okay, that's cool. And then how often should we perform self-exams, and what are the symptoms of breast conditions that we should be aware of?
Yeah, so I always encourage all my patients to be really aware of their body, very constantly watch for any changes in the breast. It could be changes in the skin texture, thickening, nipple changes, any asymmetry in the nipple, like anything that's not normal, any deviation from normal. Nipple discharges should also be, you should seek attention for that, whether it's a clear discharge, a bloody discharge, a pink discharge. Those are all things to not ignore and definitely seek attention. It could be a primary care provider, your OBGYN, who you first call, but you should call a doctor first or anything like that.
Okay. And then this also starts around the same time, 40 or?
I would say this is something that even young girls should be aware of. We are seeing breast cancer, unfortunately, in many young women as well. Oh, wow. The age group used to be 50 to 70, which is the most common age, which still is. Yeah. But we are seeing more and more young women, even in late 20s, early 30s with breast cancer. So I think all women should be very educated about at least being vigilant about how their breasts look. Yeah. And any changes, they should definitely seek attention sooner than later.
Okay, that sounds good. And can you explain the difference between benign and malignant breast lumps?
Yeah, so like I said, any change that you feel, there should be attention that you should get attention for that. And the first step that your doctor would recommend is a mammogram. Yeah. And sometimes we'll add an ultrasound for very young women who have very dense breasts. Okay. And there are some benign conditions like cysts or fibroadenomas, which do not need any treatment. Okay. Sometimes these women will undergo a biopsy just to confirm that these are benign. Yeah. But sometimes if the mammogram and ultrasound are very suggestive of these benign conditions, we don't even recommend a biopsy, and they can just be watched on serial mammograms. Okay. So those are benign conditions. Benign means that they're not life-threatening. They're not going to grow. They're not going to metastasize to different parts of the body and become stage 4. Okay. This is something that may get better on its own, or this is something that may just stay there for life. And I refer to them as like, a mole. Like a mole may just stay there and may not bother you.
Yeah, right.
So those are benign conditions. But like I said, you should seek attention, because until you get all this evaluation done, you would never know what is malignant and what's benign, right? And malignant, on the other hand, means it's cancerous, which means if we don't do anything about it, it will grow and eventually metastasize. All breast cancers grow at a very different speed. There are some slow-growing cancers which can take a very long time to grow and metastasize, versus there are some that are more aggressive and grow very quickly. So depending on which cancer, slow or fast, we have, then there is the luxury of time. Some slow-growing cancers, even if they're disregarded for a while, we can still cure them. Versus some fast-growing cancers, if we don't get attention in time, then we lose that window of opportunity to be able to cure them.
Okay. And can you, what lifestyle factors can impact breast health, and how can I reduce my risk of breast cancer?
Yeah, so that's a great question, and I really advise all my especially younger patients to be really mindful about general lifestyle measures. I think that is one of the reasons why we're also seeing breast cancer now in younger age groups, because of our lifestyle. Everyone's very busy with work. Really, health, diet, exercise is on nobody's first or second priority tasks for the day.
On back burner.
Right. It's generally, especially when you have kids, everything is so busy. You're barely surviving the day. So counting your calories or counting how many minutes you exercise in a week is really nobody's priority list. So I understand it's very difficult, but we have to start somewhere and prioritize our health, because if women, we are not healthy, we won't be able to take care of our families. We are the foundation of our families, of our household. So it also becomes our responsibility to take care of ourselves, so we can better take care of our family and our loved ones as well. Right. So exercising has been shown in many randomized controlled trials to actually decrease breast cancer risk. Even in patients who have breast cancer, the ones who stay physically active and exercise during chemo, they have shown to have decreased chances of breast cancer coming back, overall living longer, also getting through chemo with less fatigue and less side effects. So overall, they just do better with treatment. And it almost sounds counterintuitive, because you would imagine somebody on chemo will be more tired and frail. But actually, it's the opposite. So if you push yourself a little bit and do medium intensity exercise, about 30 to 40 minutes a day for about 3 days a week or something, that is considered, and mostly resistance exercises. Women, we don't consider picking weights as something that's a normal exercise to do. Generally, somebody will think maybe let me get on a treadmill, or let me just go run outside. So actually, it has been shown that aerobic exercise, cardio exercises, which are the treadmills, the rowers, running, they're less impactful in your overall health for cancer immunity and breast cancer recurrence as compared to strength training exercises. So strength training could be bands, it could be weights, so somewhere where you are, or even body weight. So that is considered about 30 to 40 minutes a day, about 3 days a week to be adequate. Obviously, it's very difficult to get there right away. It definitely takes time. But I always encourage my patients to start somewhere and then build on and build endurance. So that is something that's very important. That is something that we can do at home. That is something we can carve out 30 minutes, when the kids are asleep, or in between, once you're home, and somewhere in your day you can find 30 minutes to do that. That's very important. Obviously, decreasing alcohol. Everybody likes to have a good time when they're out socializing, but just to be mindful, ideally less than 5 drinks a week for women is the ideal way to go, so you can have the best of both worlds. You can also enjoy and also not go too overboard. Smoking is definitely very injurious. There is no happy medium. So it should be never smoking in life, right? That's the goal. And just be mindful about your diet as well. You want to make sure that you get all your basic macronutrients, like your proteins, good carbs, good fats, vitamins, lots of fruits and veggies. So the ideal is about 1 gram per kilogram for your body weight. So you want to see how your body weight is and calculate your protein content, and then be mindful about increasing that. And most of us do really bad with increasing our protein levels, and most of us don't even think about that. But it's a simple thing. 1 egg is 6 grams. So there are these little cheese balls that 1 cheese ball is 5 grams. So these are good snacks to have on the go instead of chips, processed foods. So if you go to a zoo, if you go to a park, all the kids are eating these Fruit Loops that are not actually Fruit Loops, and chips, So I think we also have to encourage our children to eat these things as kids, so that they grow into adults where this is absolutely normal. And I think that's how we can reduce obesity. We can reduce heart disease and cancer in our kids and future generations.
And this is such a like you're talking about nutrition and health, right? It gave me goosebumps. I mean, we know it. It's not like we don't, but just reiterating that.
Yeah.
And then, like, exercise can actually help with reducing cancer.
Yeah.
That is something that we all need to, like, take into consideration and actually go work.
Yeah, yeah, yeah.
And like you said, it's doable. You put a video on and you take the weights and stuff.
Yeah,
you know?
yeah.
But as women, we need to make ourselves a priority. Right?
Yeah.
Yeah, and then the protein, like, so it's funny because my son too, he's 14 now, and this, I guess in the boys now, protein for mass muscle, right?
Yeah.
So he will always look for protein shakes, and I realized once he has it, that gives him headache, and I'm like, no, you can't have it, but there's so much natural, like,
Right.
you know, we
Greek
realize like
yogurt,
avocado has it, raspberries have it, like, you know, I mean, other than the meat part,
Right,
but
right,
a lot
right.
of fruits and veggies
Yeah.
have proteins as
Yeah, like the
well.
protein shakes are not like to replace food. It's
Exactly,
more maybe
yeah.
to increase for someone who has higher protein goals.
Right,
But I
yeah.
feel like for a normal life, if we're
Yeah.
not going to a bodybuilding competition,
Exactly.
we can have Greek yogurt,
Yeah,
like, you know,
yeah.
apples, bananas, like
yeah.
natural stuff, and
Right.
you'll definitely hit your protein goals for the day with that.
Yeah, and I realize I think it's the marketing. I don't know what the kids are hearing in school and things like that. So it's like, let's go for something that's on the shelf instead of the natural.
Yeah.
I think as it's my duty as a parent
Yeah.
to, you know, direct them in the
Yeah,
natural.
yeah. Sometimes, you know, shortcuts are very enticing,
Yeah.
but at the end of the day,
Yeah.
might not be the best way to go.
Exactly.
Yeah.
So what are the latest guidelines on mammograms and breast imaging technology?
Yeah, so we recommend a 3D mammogram, which is a little bit better in resolution than a 2D mammogram.
Yeah.
And we recommend that doing that about once a year. And sometimes we'll add an ultrasound for younger women who have very dense breasts, or sometimes even in our 40s, 50s, there are some women who have dense breasts. MRIs are recommended for a little bit more higher risk women. We do recommend seeing a breast oncologist for breast cancer risk assessment. They will go through these numbers, go over these models, take into account your family history, ancestry, a lot of things like whether you're taking hormones, how old were you when you got pregnant. You know, there are a lot of factors that go into those calculations, and there is a lifetime risk of 20% or more. Anybody who has a lifetime risk of 20% or more to have breast cancer, we would recommend adding an MRI in addition to the mammogram, and then we alternate them every 6 months. But not everybody qualifies for that, so, you know, you also don't want to overdo things for general population, because nobody wants to go to their doctor if they don't need them, right?
Exactly.
Yeah, but I would say just start with your once a year annual mammogram.
And so mammograms also, I had a question for you. Like, is it, like, how bad is the radiation from mammograms?
So it's very trivial. It's basically like a chest x-ray.
Okay.
So it does not accumulate in your lifetime to be enough to cause radiation-related cancer.
Okay.
Yeah. So it's not something to be afraid of.
Yeah.
If you compare the risk and benefit ratio, the risk is very trivial and the benefit is extremely high, because with the advent of mammograms, we've actually been able to make women live longer and cure breast cancer more, because you find it in very, very early stages when you can cut it out, possibly even not need chemo, and it's cured, and in most cases, these women will be cancer-free for the rest of their life.
Wow, that's amazing. And that, I mean, like, I'm guilty because my doctor gave it to me, and I'm like, you know what, I'm just not going to do it. And I extended it for a whole year, and this is my second year to go do it. So it's important, women, you need to go get your mammogram done.
Right. I mean, ethnicity matters. It's the highest incidence is in Caucasian women.
Okay.
And you know, as women from Indian heritage, we are somewhat protected. But obviously, it's not never say never, right? Obviously, we're living here in North America. We're eating the diet here. We are exposed to environmental antigens here. So somewhere that does increase our risk as well.
Right.
And it's all modernization. It's now part of being a developed country, you know, so those diseases are going to be part of our diseases as well. Versus diseases in India are a little bit different because the demographic is a little different, the social situation is a little different. So I'd say, like, it could be for not too long that maybe Indian women will have higher risk of breast cancer matching Caucasian women as well. Yeah, so that's why it's very important for women of any ethnicity or race to be very mindful of their mammograms and breast changes.
And it's funny because mammograms, like before I had my first one, I heard from a few women that it's very painful and, it hurts and stuff like that. But luckily where I went and they did a phenomenal job, I'm like, this is easy.
Right.
This is way better than pap smear. That's my worst one. Right?
Yes.
So, so just for women, like what do you, is it that everywhere or I just got lucky? I don't know.
Yeah, I feel like also some women may have a little bit more tender breasts.
Okay.
So when you do a little bit more compression on that, they may feel a little bit more uncomfortable than somebody else who may not have tender breasts. It could be where you are in your menstrual cycle at that time also. It all affects that.
Okay.
I will say when you go in, maybe be mildly prepared that it's not the most comfortable thing. It's not a massage. It doesn't last that long. It may be a little bit uncomfortable, but at the end of the day, if you're doing something like that to as an investment in your health or your family's health and living longer, it's a small price to pay.
Absolutely, I definitely agree. So what should I know about family history and genetics in relation to breast health?
Yeah, it's a great question. I mean, the most thing you want to know about is your surrounding first-degree relatives, which is like your mom, your sister, and if any of your mom and your sister have had breast cancer, that automatically puts you in a high-risk category because at the end of the day, your DNA is coming from your ancestors, right? So even if you do a genetic mutation and we can't find a gene that is causing cancer, like the BRCA gene or PALB2 or P53, one of these common ones, your DNA is still coming from your ancestors, so it's still going to put you at a higher risk for breast cancer as compared to somebody else the same age who does not have family history of breast cancer in their mom or sister.
Right.
And then, of course, the secondary relatives becomes your grandmother's, mom's side, dad's side, maternal cousin, paternal cousin, and so on. The further out your family relation is and they have breast or ovarian cancer, the lower the risk to you, but the closer the family member, the higher risk to you. Okay. So I'd say anybody who does have significant family history of cancer, like I see several patients who are just coming for their breast cancer risk evaluation, and we can do genetic testing as well in our office. A lot of primary cares, OBs feel comfortable doing genetic tests in their offices as well. It is something that if you're interested, you may just do it, more for your peace of mind, more for your family. The panels now are much cheaper than they used to be years ago. Okay. So the max cost is $250, which a lot of patients may be just able to pay just to know that information. Right. The panels are very sophisticated, very sensitive. We check almost 77 genes now. So not only breast, we also check genes for endometrial, colon, ovarian, pancreatic, all these other types of cancers. And if there is a gene mutation we find out, then we send referrals to genetic counseling. Then the children will get tested, siblings will get tested eventually, just so that everybody's very well prepared and is more informed, and then they can do the higher screenings to prevent those cancers instead of being blindsided later on.
Yeah. Wow, I love it. I mean, we're definitely like way ahead, right? Especially, I guess, living in North America, I think that is one of the benefits we have compared to like India, right?
Right.
So we are...
Yeah. I mean, like, the resources, especially here in Houston, are unparalleled. I mean, we're very fortunate to live in a big city where the medical community is so huge and established. I couldn't imagine being in a small city and an oncologist would see you just to see if you have breast cancer.
Exactly.
Right? So I think we should take advantage of, like, this, the whole medical institution we have here. And be in the best of our health. Right. And we will definitely see patients who have even family history of cancer, just want to know their risk. And after one sitting and counseling, they can always see their primary care doctors or OBs and just see us back as needed. But it's nice to just sit with us once and actually talk regarding how is this personalized and translates to my risk.
Right, and have that one-on-one conversation. I'm sure that puts them at ease, right?
Yeah, absolutely.
That they have that help available.
Yeah.
So how do hormonal changes throughout life affect breast health?
Yeah, so as women, we all like love estrogen. We're born with it. As soon as we start having our menstrual cycle, we feel young.
Yeah.
We have babies, right?
Yes.
But at the end of the day, estrogen is damaging our breast over our lifetime.
Oh.
That's why we see breast cancer mostly in women that are in 50s, 60s, and 70s, because then they've had about like these 5 decades of estrogen overall, like slowly damaging their breast, right? So, as women, we were made to like have babies, nurse them, and then die. We weren't made to live till 100, 200,
Yeah.
which with now modern medicine and everybody, like, all our health resources, women are very easily living in till the 80s, 90s,
Yeah,
right?
it is.
So at that point, it does, every decade of our life increases our risk for breast cancer eventually. So the estrogen is the biggest factor.
Yeah.
And then another factor is our genes, which we just talked about,
Yeah.
right?
Yeah.
So genes could be something that we're born with.
Yeah.
So this is something that's been passed on in all these generations, and we're inheriting it from our family.
Right.
Or genes could be acquired.
Yeah.
So acquired means that, this is something called life that we can't control. It could be where we live, what we eat, what we drink, like, pesticides, chemicals, pollution,
Yeah.
passive smoking. So all these factors, like, may hit someone and may not hit the other person in the same environment. So it's a really like a conglomerate of all these factors that eventually lead to the cancerous changes in the breast and eventually form breast cancer.
Right.
So what we want to do is be very mindful of any additional hormones that we're putting in our body.
Yeah.
So I see this very commonly, like women are on hormone replacement for hot flashes for years and years and years.
Yeah.
And then they get used to it, and then they never want to get it off of it, and then eventually it can cause breast cancer.
Right.
So I think everything should be used for the purpose it's used, and then get off of it,
Right.
and embrace your new normal, right?
Yeah.
So hormone replacement was made to like help the transition of perimenopause, or women who've lost their ovaries early, and you still want to give them the benefit of estrogen for some part of time, and then eventually, once women are 60 or after that, they should be in their natural menopause state, which means a low estrogen state. Because if you're still giving them high estrogen and practically making them 40 years old, that's not going to be good for like the inner systems, although it makes us feel great.
Yes.
So I think that is something that women need to be very mindful of. Like, you can't really be on hormone replacement for decades. That's not the right thing to do. There has been some reports with people with BRCA mutations that even birth control, the estrogen progesterone pills, can increase the risk of breast cancer. So I'd say it's very individualized. I cannot say that birth control in the regular population, like every birth control increases the risk, but once we do find breast cancer that is estrogen dependent, we absolutely have women get off of all birth control, IUDs, no hormone replacement ever. So I think it's very important to know about what you're putting in your body.
Yes.
What is the actual consequence of that, and how does it impact you and may not impact someone else? So you can't really
like you
compare.
said, like genetics make a difference.
Apples to oranges, right?
Yeah. Okay. We're going to take a quick break, and we're going to continue this interesting conversation right after. Welcome back to Chai Time on 103.5 FM. We are in conversation with Dr. Puri, and she's giving us a lot of insight on breast health. Here's one fear, right? People have that if they do have breast cancer, then do they always need chemo?
Great question again. So it's not true that everybody who has breast cancer needs chemo. I'd say the older the patient, and by older means like anything over 55, the chances that you need chemo get lower.
Okay.
Older the patient, the more the cancers are generally dependent on estrogen, and we can block that estrogen with a simple pill that's a non-chemo pill, and that helps to decrease the risk. And the chemo is generally not very effective because it's a slow-growing cancer, and chemo generally works on more faster growing cancers better. Versus younger the women, especially anybody less than like 45, 50, higher chance that they will need chemo. It could also be possible that for a very small cancer, like a 2 millimeter, 5 millimeter cancer, we recommend chemo for a young patient, but it could be a 2 centimeter cancer for a 60-year-old, and we don't recommend chemo. So really there is no comparison. Like, there's nothing like, I got chemo, but my mom didn't when she had it, because every cancer is different. Every breast cancer is different. How we look at it under the microscope, we do a lot of studies for their receptors and do a lot of tissue testing, whether there's benefit of chemo or no chemo. And a lot of these factors decide whether someone needs chemo or not. But I generally say that not everybody needs chemo, especially once you're above 60. The chances that you need chemo are significantly lower.
Oh, wow. Okay. And so what are the side effects of chemo?
Yeah, so I always tell my patients to not think about it negatively like most of us do, and it's easier said than done, which I totally understand, because our experiences comes from like TV shows, maybe like distant family members, like or old people who've gone through chemo. So generally women, breast cancer patients go through chemo really well. There are several regimens that we will use. To explain, I always say it's like a chemo light version and a chemo heavy version. So not everybody gets the chemo heavy. Unfortunately, most patients with the breast cancer regimens will lose their hair, which I know is something that's very close to our heart, and it's very impactful just emotionally. But it is a temporary change, depending on which chemo regimen we are using. It could be a 3-month regimen, a 6-month regimen, and it's just for that time, and eventually they will get their hair back. So it is a difficult time, especially with women with young children. They're doing a lot of stuff socially with their kids as well. It's hard to make peace with it, but we have a lot of social support that also helps with coming through terms with these new life and normalcy. And once women get that past that, I think it's much easier to go through chemo, because then you made peace with it, you're more positive about it. But in terms of side effects, our regimens have more remedies, and nausea and fatigue and a lot of other things are very nicely managed. I have patients who go to work throughout chemo. I mean, I don't think you can pull a 60-hour work week, but I think if you just let your employer know, they are very willing to work with us, and we can do FMLAs, we can make sure that they have the support. But most women love going to work because it actually distracts them. It makes them feel more normal. You have a goal that you're working towards at home, and that keeps you more positive. So we really encourage that. And coming back to my exercise point also, we really encourage them to be physically active and actually work out and exercise. So I would say I would term chemo as more negotiable now. Obviously nobody looks forward to it. It's not fun, but I will not paint a horror story. And I'd say most women after their first cycle, they're like, oh my goodness, this wasn't as bad as I thought it would be, right? And chemo at the end of the day is an art. You have to give the right dose to the right person. You have to manage the side effects very promptly, reduce doses. So if an 80-year-old is doing chemo and are doing a very high dose of chemo, it's not going to end very well, right? But with a 40-year-old and dose tapering, taking into consideration how they're tolerating, we can get them through with good tolerance. So I think it's a great teamwork between our physicians, our nurses, our infusion nurses, the patients, their families. So we all work as a team to make sure that at the end of the day, it's the patient who has to get through this, testing time and come out victorious.
Oh, wow, okay. And I mean, I had, so when school had just started, it was during COVID, and we had a teacher, I didn't even realize, it was just the beginning, and she was a kindergarten teacher for my little one, and she was going through chemo while school started, COVID and stuff, and she was always so positive, and she's like, it's not that bad. So it always, I always have that soft corner for her. And now that you're saying, y'all tried to manage the symptom, that makes it. I'm like, how are you at work managing these little kids, right? It must be so stressful. But she was doing always with a smile. Them going.
So I mean, I want women to get that notion off that 3 months of chemo means I lose these 3 months in my life. We actually work with you. If you have a wedding to go to, we make that work. We make sure that we time the chemo accordingly. If you have a family event, holidays, and there are a lot of now beauty resources as well. There are women who can teach them eyebrow drawings, hair wigs and scarves, just to make them feel whatever they feel comfortable in. So I think we've come a really long way there. I think you can make the most of those 3 and 6 months as well.
Yeah.
And generally when we recommend chemo, you're getting at least a more than 6% benefit in decreasing your recurrence. And in most young women, it can be as high as 15 to 20%, you know. So it is for a reason that they are getting the chemo to decrease the risk of it coming back at stage 4, at which time it's not curable. So, you know, this is where we can give it our best and leave no stone unturned for a better future. So if we consider that and then, you know, come to peace with those side effects, it makes it a little bit more easier to navigate.
Right. And I just love the value of life and the value of little things that we have here, right? Like you said, just making them look pretty, because that's important to women. So y'all have taken care of such little things. That just gives me, like, you know, goosebumps. So okay, what are the myths and fears with like PET scans and radiation?
Yeah, I mean, I'll start with the one you just mentioned, the painful mammogram. So, like, you know, they are uncomfortable. No one looks forward to it, but it's not the end of the world. It will be over before you know it. So go get your mammogram. And then I'd say PET scan has definitely a lot of myths around it. Like, people think that, you know, if you eat a piece of cake, cancer will grow. So that's really not how it works. It's just like the PET scan actually uses a dye, which is basically a sugar that's radioactive. And then the sugar is taken up in the cancer cells more than normal cells, and that's how the radioactive dye lights up and looks bright and yellow when we take a look at it, and that's how it shows it's the cancer. So I think the myth maybe somewhere started from that the PET scan cancer takes up sugar. So it's really not that you'll have a donut and or cake and then your cancer will spread. So, you know, you have to enjoy life. You have to enjoy your birthday cakes and everything. But again, coming back to my diet and exercise story, that everything in moderation. At the end of the day, if you're eating like without any limits, obesity and weight gain will predispose you to more cancers and doing worse with cancer. It has been shown that women who are obese live less long than women who are not obese and are more physically active. So at the end of the day, you want to lose weight, you want to be healthy, because that gives your body a more fighting chance to beat the cancer and give you your immune system more power to take care of the cancer on its own. Versus the more obese you are, there's a lot of chronic inflammation going on in the body, which does not help heart disease, does not help cancer, does not help your side effects.
And then, are there any particular resources or support groups you recommend for breast health education?
Yeah, so I mean, you know, breast cancer is the most common cancer in the country. I mean, 1 in 8 women have breast cancer. So it is not hard to find another woman, even in a grocery store, who's in the same boat as you, right? So there are so many support groups on Facebook. We have nurse navigators who meet with the patient the first time they come after a cancer diagnosis. They'll offer them all the resources. We also have chaplains, spiritual programs, and they don't even focus on the religious aspect. It's more about, you know, making peace with the diagnosis, connecting them with their support groups. So there's Susan Komen, which is the foundation, the Breast Cancer Foundation. So there's a run every year in October, and all families, patients, providers will, like, you know, make that run. So there's so many opportunities to connect with, like, fellow, you know, patients who've had breast cancer. They're basically endless.
And so, how does age impact breast tissue and overall breast health?
Yeah, so dense breasts do increase risk for breast cancer, and that is like regardless of your age. So even if you're a 60-year-old with dense breasts, your risk for cancer will be a little higher than another 60-year-old with fatty breasts. Also, dense breasts don't make it easy to take a look, like to see masses on mammograms, because your breast should look a little bit more black or gray, and the mass looks more like a little more conspicuous white. But when you have dense breasts, like, everything looks a little bit gray-white, so it makes it a little hard to pick up small masses. Other than that, women generally have dense breasts when they're younger, like in their 20s and 30s. That's why we also don't recommend mammograms in the 30s, because you really can't see anything. But as we get older, our breasts will naturally get a little bit more fatty. And then the mammograms are a little more sensitive. But there are women, even in their 70s, that may have dense breast. And that ties in with a little bit higher risk of cancer because of dense breast.
Okay.
Yeah.
And then what about men and breast cancer?
Yeah, so, men are not immune
Yes.
to breast cancer. It is extremely rare, but it is possible. Definitely all men are tested genetically for mutations.
Okay.
The most common mutation is the BRCA2, which also increases risk for prostate cancer and pancreatic cancer.
Okay.
So generally, if a man has breast cancer, it is more common to be tied to a genetic mutation versus less than 5% women who have breast cancer will have a genetic mutation.
Oh, wow. Okay.
Yeah. So that's why it's very rare in men.
Okay. And then what emotional or psychological support is available for people dealing with breast?
Yeah, so it comes back to our nurse navigators who really meet with the patient. Our support staff is very cognizant about these changes. Even when the patients are not coming in for visits, we'll have our support staff check with them periodically, how they're doing at home, side effects. And obviously, if there is something that they need to seek attention, they'll bridge the gap with us and them. So if the patient hasn't called us, the nurse navigator will reach out and be like, hey, there's a problem here. And then we'll make sure we intervene and fix the problem. And Facebook support groups, a lot of societies that have resources for breast cancer patients. There are a lot of online tools as well, music therapies. So it's, at the end of the day, it's to each their own. Music therapy may not be something that everybody loves. Pet therapy is not something that everybody may love. So it's really what works for someone. There is a resource for everybody and whatever they're interested in and what helps them pacify their fears.
Oh, wow, that's amazing. I can't believe we are almost at the end of the show. Is there any other information or any last words you want to share with us? Like one thing women should know, what would you tell them?
Yeah, I feel like there is something that I'm very passionate about, like pregnancy-associated breast cancer. So I feel like this is not something that's very well known. The definition for pregnancy-associated breast cancer is very vague. Some people will define it as within 3 years of your pregnancy. Some people will define it as within 5 years of pregnancy, right? Okay. So generally these cancers are more aggressive than non-pregnancy-associated cancers. It has been thought that some hormonal changes in pregnancy may trigger the aggression in these cancers. So I'd encourage women to be very mindful during pregnancy, breastfeeding, and even years after that, to be very mindful about any changes in their breasts or any lumps, to not disregard that as hormonal changes or lactation-related changes. So you should definitely seek attention, get a mammogram. We do have great treatment options. So obviously, if they're caught early and they get the right sort of treatment, it is very gratifying to see a pregnant woman who had cancer do chemo during pregnancy, deliver a child, and then they're cancer-free, and the children are now growing and thriving. So we generally wait until the second trimester to do chemo, and it has been shown by picking the right agents, there is no to minimal harm to the baby. I have seen so many babies delivered and now they're thriving and growing absolutely normally, and the moms got chemo during their pregnancy. It all again comes to getting attention as soon as possible so that we can devise a treatment plan. We work with the OBs, we work with the families. We want to make sure that at the end of the day, the mom and the baby are the priority. So that's something that most people don't know about. But
I had no idea I had 2 babies. But what you were saying about postpartum too, right?
Yeah, so it can be up to 3 or 5 years after you deliver as well, and it could be related to the changes in pregnancy. By no means that means that nobody should get pregnant. Obviously, it comes with all the other complications of pregnancy. If you have gestational diabetes or preeclampsia, that's not something you can predict. You just deal with it and move on. And in the long term, in fact, pregnancy does protect us from breast cancer. Right, so it's a double-edged sword, right? So women who've had no children when they're 50, 60 in their lifetime do have a higher risk of breast cancer than women who've had 3 or 4. Right? So in the acute phase, it can cause more hormonal changes to cause cancer, but in the long term in life, it is beneficial to protect us from breast cancer. So it gets very complicated, and I don't think anybody in the world knows exactly the recipe for how things happen, but that's what we know so far.
Yeah, that's amazing. And then I think one thing that's really stood out for me is you you have to stay vigilant of your own body and your own health, right?
Right.
Like even through pregnancy, there's so many changes happening. But if you see a lump or something, because women are like, especially me, I'm like, okay, we'll worry about it later. Like,
Right.
you have more pressing issues.
Correct.
But like, if you can't take care of yourself, then what happens to the baby, right?
Right, right.
So, yes, absolutely. Thank you so much for coming on the show and taking the time. This was so insightful. We loved having you.
Oh, thank you. I appreciate it. It was my pleasure.
Thank you. We're gonna thank you, listeners, for staying on the show, and we'll see you next Monday, same time, same place. Bye bye.